Minister, I have sympathy to a point for the position that government finds itself in terms of, I suppose, the runaway budgets and the difficulties in terms of trying to rein in spending. But a recruitment freeze is a very blunt instrument to use because it basically cuts across all systems, be it the community or the acute or the primary care systems. And I don't believe it offers anything in terms of trying to figure out who's actually doing a good job and who's not, or even more importantly, who is in the most deficit in terms of people as opposed to who are not. And we have that imbalance right throughout the health service, and that is something that we haven't really tried to address. And I would say that the recruitment ban is penalising all systems in healthcare at the moment, and I cannot see how that can be placed anywhere as being within the interests of patients. Can I speak to our own Model 4 hospital in Waterford, which, not surprisingly, Minister, I bring up because, you know, I'm deeply engaged with the issues of that hospital. And I point out to you that we had a commitment to open the hospital up to a 7-day cardiac access, cath lab access. And back in July, you were in the hospital and you graciously came down to meet staff on the ground and to welcome the opening of the second cath lab, which I do too. But I pointed out at the time that there was no budget there to implement the 7-day opening. And even though you offered to the staff it was your intention that the hospital would open to 7-day opening at the end of the year, I told all on Sunday there was no budget in place. And how could that not have been known before a health freeze came in? And we now have the position that in terms of the present health freeze, if we're going to recruit these people, we're going to have to seek a derogation. And I hope that's what you will do, Minister, because I think that is one commitment that government has given that they cannot turn away from. We have to get that 7-day cardiac cath lab access in there for heart attack patients on the weekend. But beyond that, I'd also point out to you that as part of the end of COVID and the problems of the Wexford fire closure, University Hospital Waterford opened an additional step-down facility up in Kilcreen, doing orthopaedic and surgical step-down, and they were operating between 12 and 15 beds, and I think they had put in a business plan at some point showing that they could operate 18 beds, and that was having a very, very marked impact on the day cases and on the admissions out of University Hospital Waterford. And it was being done very efficiently by University Hospital Waterford staff on the ground in Kilkenny. That has now had to be stopped. That activity has now stopped, and all of that activity has ceased. And by the way, Minister, part of that, nothing to do with the HSE freeze, is the money that was burned up from the UHW budget in dealing with the Wexford fire. And I understand there is a very, very substantial multi-millions bill awaited by Ireland East to recompense the hospital in Waterford. And the question is, why should we be stopping services because we cannot get paid from another part of the system to pay us? And the other point I'd make to you, Minister, is regarding consultant posts. And we have 2 emergency consultant posts and a radiology post have been held up there for months with the CAAC. And just as they're approved now, we're told that it has to go back to Southwest Group. And what are the chances they'll give us funding? I'd say not very much. So, Minister, I am struggling to understand the benefits of this health freeze, and as I say, there's nothing targeted in it. And the other thing I would say to you is in terms of the digitisation of the health service and the need to try and bring in efficiency monitors into what people are doing. Now, the Taoiseach said here on the record of the Dáil this morning, when asked a question about the health freeze, he said that it was not, that nurses could still be recruited. I'm not sure if you can provide any clarity to that. He said nurses, it was still possible to recruit. That's not the information that I'm getting. So we can't recruit anybody, as I say, in Waterford, and as from talking to other people across the system, the impression is that they can't get there either. But back to the issue of efficiency and digitisation, Minister, I think you need to start tackling the efficiencies of the hospitals and the acute sector in particular, and look at who's doing what well and who is not. And rather than bringing in this blanket ban on recruitment, start to look at those hospitals that you said earlier in the year which you were going to reward for the efficiency metrics they had gained, rather than penalising them right across the board with this health freeze. So I welcome the Sinn Féin motion here because it draws attention to the fact that this health freeze is not going to work. It's not going to work for patients, it's not going to work in the system, and it's not going to reduce the budget very much either. So we wait to see what other plans you might announce, Minister.